So we are learning a lot from GWAS studies, and we keep learning a lot from them. The latest GWAS study had more than 100 SNPs that were found. So there's very much an increase in the amount of people that can be included, and because of that, there's also an increase in the amount of SNPs that are being found. And these SNPs are teaching us about the pathological mechanisms that are causing migraine. And they tell us that there's something going on with neurons, but there's also something going on with vasculature. And this is a very interesting finding, and this is something that we will have to keep looking at. And one of the challenges that we now face in the fields of genetics is going from a SNP to actually the protein or the mechanism that is causing the increase in migraine risks. So that's something that we are still very much working on, and that's a pathway that will be very valuable in the future. A lot of the previous GWAS has tried to also look at this. Some even were performed in only migraine with or migraine without aura, but it wasn't very robust findings yet because we didn't have the numbers. And now the numbers are there, and this we were kind of hoping somewhat it would settle the debate. Is migraine with aura a completely different disorder than migraine without aura, or are they actually the same disorder? That's a debate that's been going on for quite some time in the migraine field, and we thought that genetics might be the answer, but it turns out, as most things in life, that it's much more complex than that. So the recent GWAS showed that there were several SNPs that were associated only with migraine with aura, some that were associated with only migraine without aura, but also a couple that were associated with both. So this means that indeed there are differences when you look at genetics, but there are also a lot of similarities, which is kind of what we would also expect when you look at the disorder itself. So this is something that we're still working on, especially because possibly these genes that are specific for the types might be very valuable treatment options.